Good morning, everyone. Finally, we're going to start the symposium. Welcome to the very first Human Flourishing Symposium, exploring pathways to thriving, shifting from deficit to possibility. Yay! I wanted to mention that our Dean, Betsy Farmer, Dean of School of Social Work, she was going to do the opening with me today. Fortunately, she had a family's health issue, so she couldn't make it, but she sends warmest regards and best wishes for all of us. I just wanted to mention that. My name is Deborah Moon. I'm an assistant professor in the School of Social Work. I'm also the director of the Flourishing Research Lab and a lead convener of the Flourishing Research Collaboratives, FRC, that organized the symposium. I wanted to start by recognizing the members of the FRC team who worked so hard to make the symposium a reality for all of us. So I wanted to start with Ronnie Doko. He's like walking in the back right there. He's the Associate Director of the Center on Race and Social Problems and founding director of the Racial Equity Consciousness Institute. He's also a research assistant professor in the School of Social Work at Pitt, and then he's the co-convener of FRC. So he led the entire planning for this symposium, which is really incredible. And also wanted to recognize Dr. Daniel Hyungjik Lee, who is a research associate in the School of Social Work and also a member of FRC. We also had a lot of doctoral students and master's students helping out with the organizing the symposium. And as of this moment, they are working very diligently somewhere behind the scene to make sure that the symposium run really smoothly. So let's just recognize their service by giving a round of applause. Thank you. So I wanted to start by giving you a little bit of background how all this thing, the Human Flourishing Initiative came about. And to share that, I wanted to say a little bit about my professional background. So before I came into academia, I used to work as a trauma therapist. So I saw a lot of children, youth, and families who were involved with the child welfare system because of the issues related to child maltreatment. And a lot of kids that I saw, it was really incredible honor for me to really witness some of the kids really, start reclaiming their goals, life goals, and then really walking into the path of healing and recovery. But I just couldn't, stop, wondering what their lives would have been like if, none of these things actually happened to them in the first place. So I really embraced the idea of the prevention is the best cure. So when I started my PhD program, I focused on research related to preventing child maltreatment and trauma and mental illness. And then a couple of years ago, when I was conducting a research project, which is a Children's Bureau funded project where we developed and evaluated a child maltreatment prevention program in the state of Ohio, I had a chance to interview a parent who participated in that program. And she was sharing her experience, saying that she really enjoyed the program and wanted to share about this program with other parents in the neighborhood. And then she expressed this concern. I don't really know what to say if they say something like, well, what's the program for? What are they doing? Why are they doing this? And you say so that it helps child abuse not be prevalent. It's like, it don't really sound right. We'll give you the support so that you don't abuse your child. It's almost kind of like you're implying that that's what we're doing, or abuse potentially can happen because we're poor, so to speak. So, none of the providers actually explicitly said that this is a child maltreatment prevention program. But this parent actually Googled and found on the internet that this agency who were delivering the services were known for child maltreatment prevention services. So this experience really helped me to think about how prevention language that we're using can be very stigmatizing and very disempowering, especially for folks who belong and to various marginalized communities. And then very similar idea was expressed by the leadership that we interviewed, who said, the fact that we're an agency dedicated to prevent child abuse makes our marketing difficult. You never want to tell somebody, I'm giving you this so that you don't abuse your child. It's almost as though you have to refocus it, reframe it. It has to be more strength-based, and that we are here to strengthen families and to support families. So this experience really pushed me to think about, so how can we really shift our mindset from wanting to prevent something negative to wanting to promote something positive, really caring about the presence of well-being. So that kind of sums up my professional journey, starting to focus on the treatment and then transitioning to prevention, and then more recently really thinking about promotion. So it doesn't mean that we're not going to do treatment, because some people really need a more intensive level of services. But even when you do treatment, even when we do prevention effort, how can we really learn to articulate the work that we're doing so that the work is not really focused on fixing problems or addressing just deficits, but more about really building assets and then building the future. So really start speaking that promotion language is something that I really wanted to advance in the larger health and human services field. So what do we want to promote? So I wanted to show you this picture. It's a picture that I actually took myself in Honolulu, Hawaii, a couple of years ago. I'm not a photographer, but I'm pretty proud of this picture. It makes me smile every time I see the picture. Any word that comes to your mind when you see this picture? Sunny? Okay. Peace? Anything else? Flourish. You got it. That's what the answer that I wanted. So actually, I don't know if you know that the term flourishing originated from the Latin word flore. So that's not really the correct pronunciation because I don't speak Latin, but it means bloom to flower. So the working definition of flourishing, although this is a very loose definition, is a state in which all aspects of a person's life are good, including the context in which that person lives. So when you think about like flowers, for flowers to bloom, of course you need good seeds, right? But that's not enough, right? Flowers need adequate amount of water, sunlight, and then nutrients. So the definition of flourishing in this way really implies the interconnectedness of an individual with the environment surrounding the individual. So of course, this is a very loose definition. There is actually a lot of intellectual scholarly work that is going into the effort to really try to define and better operationalize what flourishing is. So there are, as a research field, this is a young area of study. Still, there are a lot of unanswered questions, including why flourishing? Why do we need to talk about flourishing? Especially these days, there are so many challenges that we're facing collectively as a society. Is this where we want to think about flourishing? And why do we need to think about flourishing? And what is flourishing? How do you define it? Who gets to define flourishing? Whose flourishing matters? So these are all the topics that a lot of scholars are trying to figure out. And then the symposium, we put together this space so that we can engage in deep reflection and discourse and dialogue around these very important questions. So we have a lot of sessions lined up today. Right after my talk, we're going to have Dr. Ramesh Raghavan doing the keynote presentation. And then after that, we're going to have lightning talk sessions where we'll have multiple researchers and practitioners. They will do 10-minute, very short talk, really highlighting the core work they're doing in terms of promoting human flourishing. And then after lunch, those speakers, they're going to come back to form an interactive panel, and then we'll really get to dig deeper to ask all these questions that are important for us to address today. And then in the afternoon, we're going to have a plenary session led by Kyan Corner, who's the director of the Center on Race and Social Problem at Pitt School of Social Work, who will be joined by 4 panelists who are all directors of public health and then human services programs in Pittsburgh, and then the greater Pittsburgh area. So I really, and also wanted to mention that we have breaks in between. And then the poster exhibitions that you saw in the morning, that's going to continuously run throughout the day. So if you haven't had a chance to look at the poster, please go and then interact and engage. So with this, I'd like to invite you all to really get ready to really take a deep dive into, really immerse yourself into the keynote from Dr. Ramesh Raghavan. I'm going to introduce him. Dr. Raghavan is a professor at NYU Silver School of Social Work, a psychiatrist and mental health services researcher by training. Dr. Raghavan conducts research on the needs of vulnerable children in the U.S. and overseas. His work spans studies of access to mental health services, quality of care, economic evaluation of implementation strategies, and child well-being. He's a former chair of the National Institute of Mental Health Services Research Review Committee and currently serves on the editorial board of Administration and Policy in Mental Health and Mental Health Services Research. Dr. Raghavan has held prior academic appointments at Washington University in St. Louis and Rutgers University. In 2015, he served as a senior advisor in the Administration for Children and Families, working on a variety of child-focused initiatives within the Obama administration. He's a co-author, along with Dr. Daniel Eisenberg, of the book Investing in Children's Mental Health, which is published by Oxford University Press in 2023. So with that, let's welcome Dr. Raghavan.